This presentation is adapted from Pulmonary, Sleep, Cardiology, and Critical Care Academy, an online CME-accredited course for advanced practitioners and physicians. The next mode of ventilation I want to discuss is AC/VC, or assist control volume control ventilation. This may have different names on different ventilators, but you'll recognize this. It's our basic volume cycled ventilator mode. Volume is the independent and pressure is the dependent variable. So we set the volume, but we don't know what the pressure is until we look at the machine. It's what we traditionally have used as the resting mode, where all patient efforts are assisted by the ventilator and we deliver a set volume at a set flow rate. This is triggered by the patient's respiratory rate, provided they're breathing faster than the set rate. But no worries, if they stop breathing or they slow down, they'll get a machine delivered breath at the set rate. So they're guaranteed to get at least the set rate, let's say 15 per minute. We cannot wean the patient by lowering the set rate. For example, if someone's breathing 20 and the set rate's 12, and then we lower it to 6, they're just going to continue to breathe at 20. They won't even know we were in the room. So here's an example of AC/VC. In this case, the patient makes efforts every 3 seconds, so maybe 20 times a minute, but suddenly they slow down and the machine sees 6 seconds goes by without an effort, so it delivers a controlled breath. You can deduce from this graph that the set rate is 10, because when the patient's not making an effort, it's giving 1 breath every 6 seconds. So here's the formula. The set rate of 10, the timer is set to 6 seconds because it's 60 divided by the set rate. That's the formula. In this case, the patient's going to receive either their rate times the set tidal volume or the set rate times the set tidal volume, whichever is greater. So if the set rate's 10 and they're not breathing, they'll get 10 times, let's say the tidal volume is 600, they'll get 6 liters. But if the tidal volume is set at 600 and they're breathing 20, they'll get 12 liters. 20 times 600 is 12,000, or 12 liters. So in this example, the patient's on AC/VC mode. So what we have is we've set the machine at a target tidal volume of 350. That's actually the actual set tidal volume. And we actually set the flow pattern to a ramp. It's prescribed. We set the maximum flow. So we say it's going to flow in up to 40 liters a minute and then flow down to 0 to deliver 350. We are actually setting the flow pattern. What we don't know is what the peak pressure is going to be until we look at the patient. But in this case, on this breath, it was sort of 33, and in this breath, it went in a little bit different. The patient interacted with the machine differently, and it only went up to 30. So the inspiratory time is determined by the actual volume and flow pattern. So in this example, we set a maximum flow of 40 with a ramp. That means the average flow, because of this ramp, is 20 liters a minute, which is 0.333 liters per second. 20 liters a minute, there's 60 seconds in a minute. So it's a third of a liter per second. Therefore, because we prescribed 350 cc's, not 333, it will take just over a second to go in. The machine knows how to figure out the time to deliver the volume. If you'd like to learn more, please visit our educational center at pulmonaryandsleepacademy.com, where we have 70 hours of self-paced online CME-accredited courses covering pulmonary, sleep, cardiology, and critical care medicine. Please enjoy more of our short visits on our PSA YouTube channel. You can purchase our full courses with an exclusive 10% discount code using YouTube10.